Good morning, everyone. Good morning. I am really excited to see everyone again this year. I want to bring greetings from Congresswoman Robin Kelly. She'll be joining us later on this afternoon, and her staff. And I want to bring greetings from our staff, the National Minority Equality Forum. We live in interesting times with great opportunity. And over the course of the next 2 days, we hope to explore with you some of those opportunities. There's 2 words that I want to call your attention to in the program. Healthy communities. We are fundamentally about building healthy communities. Those who know me know I have the curse of being a historian. And I particularly have a tremendous interest, obviously, in African American history. And I tell our staff that the best and the brightest in our community for 300 years had to fight with slavery. The Frederick Douglasses, the Phyllis Wheatleys, and all of those who led the anti-slavery movement. We came out of the anti-slavery movement and had to deal with segregated America. W.E.B. Du Bois, Martin Luther King, and all of those civil rights activists. In my mind, 1965 created the new era, where for the first time, African Americans in this country could begin to have a conversation about what communities they wanted to live in, have their own choice about building community. And as we look at it, we say to ourselves, the role that we want to play in that conversation is about building healthy communities. Others will take on education and workforce and investment, and all those things have to be done. But our conversation here is about building healthy communities. And what's really important, I think, about the African American experience is that we're like the canaries in the coal mine. The Founding Fathers had a vision, but it wasn't really fully articulated and expressed. And it was put into our hands to make sure that the idea that all men were created equally, endowed by their creator, et cetera, was realized. And so when we think about building healthy communities, we're not thinking just about the African American experience, we're thinking about the American experience. How do we build healthy communities for America? I would argue with you to say that the 21st century is about health. It's about how do we build sustainable, healthy communities. That is the conversation about the 21st century. Lots of things in the way to get there, meaning people think that we're still in the 20th century and we don't have the capacity really to take on the fight for healthy communities. I fundamentally disagree. I think we're incredibly smart and innovative. And I think when we come to the end of the 21st century, if we're not controlling health outcomes in our community, if we haven't won the war on cancer and lupus and multiple sclerosis and diabetes and heart disease, we have fundamentally failed. We have fundamentally failed the challenge. And so we've put together a program for you today to start that conversation, to start that movement forward. And there are lots of people who will disagree with us and believe that their neighbors shouldn't have health care and don't care about whether the diabetes epidemic runs rampant, whatever. But we come from a long legacy of people who fought for a vision. And that's what we're about here in this conversation this morning. And I'm really excited because we're joined by some of the presidents of the organizations that are going to lead that struggle, who are fundamentally at the vanguard of that struggle, reshaping and rethinking how we deliver health care in America. So I'm going to start off with a great pleasure. Many of you may not realize, but we've been working with the American Medical Association at this summit for a very long time. They've been in the background and helping us shape and think about this. And so it's really with a tremendous pleasure that I ask the President of the American Medical Association to bring you greetings, Dr. David Barbe. Good start.
Thank you, Dr. Puckrein, and Mr. Hamlette, Drs. Rios and Tran, and honored guests. It is such a privilege for us to be here and to be part of this meeting this year as we continue together the very important work that Dr. Puckrein described to achieve health equity for all Americans. At the AMA, our mission is to promote the art and science of medicine and the betterment of public health. And in this context, public means all persons, including the most vulnerable among us, those with low incomes, refugees, immigrants, racial and ethnic minorities, and the disabled. Our commitment as physicians to all people is embedded within our AMA Code of Medical Ethics. And two key principles of that code are: we are to support access to medical care for all people, and we are to provide competent medical care with compassion and respect for human dignity and rights. That's why non-discrimination, health equity, and access to health care for all are key goals that permeate all of our work. I'll have a lot more to say about the AMA's commitment to health equity and actions that we're taking to achieve it in a few hours during our lunch comments. But in the meantime, welcome, thank you, and I look forward to a very productive meeting this week. Thank you.
Another great partner has been the National Medical Association, and really Martin Hamlin, who's their executive director, has been really an ally and a strong commitment to bringing health equity. So I asked Marvin to come and say some words. Thank you.
Appreciate it. Good morning. Good morning. Thank you. It is truly an honor and a privilege to join you this morning for the kickoff of such an important meeting. We are pleased to be partners with the National Minority Quality Forum, as well as the other medical groups that are assembled today. I am Martin Hamlette. I'm the Executive Director of the National Medical Association. Our 118th elected president, Dr. Doris Brown, had a scheduling conflict just this morning, and of course will join us over the course of the next 2 days. The NMA is the oldest and largest organization of African American physicians, representing the interest of over 30,000 across the United States through 33 states, 132 local chapters and societies. And so events like these and activities and education efforts that help to promote access to underserved populations, that help to push for health equity, and that really focus on wellness, not only through the direct treatment and provision of medical care, but truly focusing also on the social determinants of health, that, as so many studies have shown, really play the large part, the lion's share of health outcomes for the patients that matter most. So we're pleased to be here today. We applaud your efforts. We applaud the other groups that have joined in and individuals that have joined in to make this meeting a success. Thank you for attending. Thank you for all that you do. And again, congratulations on a great meeting.
Dr. Elena Rios is president of the National Hispanic Medical Association. She's been a friend and an ally for years and years and years, and it's really with a great pleasure that I ask her to come forward.
Thank you, Gary. I too welcome everyone, and it's a pleasure to be up here with all the organizations. And we also want to announce, I know Ho will also announce tomorrow at the Office of Minority Health meeting at HHS, that the 4 or 5 organizations now, the National Hispanic Medical Association, the National Medical Association, the National Council of Asian American and Pacific Islander Physicians, the Association of American Indian Physicians, and the Association of Black Cardiologists have formed a Minority Physicians Alliance. It's been a long time coming. We all have been working together for over a few years now, meeting monthly, and we're very happy to announce that together we are going to help with the healthy community sustainability approach that Gary's mentioning. Also, I think the concept of culture and health, the concept of health equity for our emerging majority populations. We all know how important leadership is, and that's why I believe it was about time that we come together and work together on leadership development, not only for our own organizations, but for America. And I do think that the NHMA, the National Hispanic Medical Association, has been now for over 20 years, 25 years actually, has been developing leadership through our fellowship programs for physicians, residents, and medical students. We have 6 regions. We're hoping to develop the chapters at more local level, national conference, regional conferences in the fall, and our scholarship dinners in the winter. We have been building a network with our levels of our Council of Young Physicians, Residents, and Medical Students. But most importantly, we have been focused on 2 things. One is developing the human capital for leadership within research and academics through our patient-centered outcomes activities, through our research activities with NIH and with also with the All of Us research program that you'll hear more about this next few days, and I saw the handouts in the back. But we're a national partner with the NIH on making sure that 1 million Americans get connected to the All of Us research program so that we have more data on our minority communities so that we can have healthy communities. And the second thing is we're looking at leadership in the private sector, whether it's our partner organizations like insurance and pharma companies, or whether it's our private practice physicians. We're still in solo practices in small groups, clinics, hospitals, and we need to build the continuing expertise, especially in primary care and specialty care in our communities. And to that end, we've developed our College Health Scholars Program to recruit more Latino students and others in our underserved and underrepresented communities, to be mentored by our current Latino and other underrepresented students within medical, dental, public health, nursing, and science graduate schools, and also to develop campaigns for our physicians and patients with CDC and HRSA and Office of Minority Health. So we're very pleased to be here, very pleased to work together with all of the organization, and Gary, especially with your leadership. Dr. Christensen's here. I have to say hi and thank you for your leadership for all of us, for health equity for our communities. Thank you.
And finally, but not in any sense least, is Dr. Tran, who's president of the National Council on Asian Pacific Islander Physicians. She's been really a super friend and has really sort of pushed us all together and has really been a driver in the conversation.
Thank you, Gary, and good morning, everyone. On behalf of the National Council of Asian Pacific Islander Physicians, we are very pleased to be here with you today and very honored to share with you our thoughts. And before I say anything more kind of serious, I would like to thank Gary and the National Minority Equality Forum about, that they embody exactly the term health equity. If I can use the picture of a wood fence looking through to see the soccer field, And Gary has created a hole in the fence for us to look, that is equity to us. He has included us, and we are here together to work on building the healthy communities with you all. So, to continue with what Elena was saying, and also to continue what Gary and his organization has created, years ago and until now, it is to build a coalition and alliance to help build that healthy community with you. So over the years, we have worked from the National Minority Association, from the National Hispanic Medical Association, the Association of American Indian Physicians, the Association of Black Cardiologists, and the own organization. We have worked over the years to create an alliance because we understand that racial and ethnic disparities in healthcare and underrepresentation of minorities in the health professions still persist. The latest National Healthcare Quality and Disparity reports from the Agency for Healthcare Research and Quality documents racial and ethnic disparities across a multitude of access and quality measures. And many racial and ethnic populations remain underrepresented in health professions. So we have for the Minority Physicians Alliance, because April is Minority Health Month, we have come together and to form the alliance and to work in partnership to bring greater attention to persistent racial and ethnic health disparities, exactly your agenda, highlight the importance of racial and ethnic minority physicians as essential community providers, very much, who we represent, and speak out against proposals to deny or limit access to healthcare for the medically underserved, including low-income people of color, immigrants, and refugees. So together, organizations are committed to working together to reduce disparities and improve the health of all Americans toward three broad goals. The first one is to reduce the burden of diseases that disproportionately impact American Indians and Alaska Native, Asian Americans, African Americans, Hispanics, Native Hawaiians, and Pacific Islanders, and other medically underserved patients and community. Number two, support physicians and other healthcare providers who treat underserved minority population. And number three, advocate for funding for research initiative and public policies that will lead to better understand intervention and treatments for our diverse racial and ethnic minority population. So thank you very much, Gary, for the invitation, and we are all here with you. Thank you.
Before we have our start on next sessions and go into our breakout, I'd be remiss if I didn't take a moment to ask Congresswoman Christensen to stand up, because what you may or may not know, the reason why you're in this room is because of her. We're both just showing a little gray in our hair. That's why we've been around a little while. But we started all this it's actually going on 15 years. The Black Caucus Health Braintrust did a spring meeting, and we did a spring meeting, and we said, why don't we come together and do one event? And it's really been very productive. It's in this meeting here where conversations about Obamacare were held, and conversations about getting people enrolled in Obamacare, and lots of other policy issues were taken on. Some of it in this room, and some of it in the hallways. And she was really just a driver and a friend. And one of the things I marvel about all the time is that so many Americans that she's helped don't even know it, don't even know what she did. And so it's really a tremendous honor to have her with us today, and but for her, we would not be here. So thank you so much. Okay, so now it's on to the business of the day. So two things I would ask of you. Please enjoy the sessions. And there are really some tremendous people in the room around you. Get to know some of the folks who are here. This is a tremendous networking opportunity, as they say. And so we'll circle back. Thank you so much.